Welcome to the Health Tech Edge, the podcast on how technology is reshaping healthcare operations. I'm Mike Moore. Today, I'm joined by Jamil Afza, co-founder and CTO of Mitali, an AI companion built for people living with dementia and the families caring for them. Jamil, good to have you on.
Yeah, thank you. It's great to be here to talk about something meaningful.
So let's start with kind of why you're working on this. You spent years in digital health, places like Novartis and Takeda. It's a pretty specific problem. So why dementia?
Yeah, so I was in various consulting roles, and then my father was diagnosed with Alzheimer's, and it was a tough time, and I wanted to pivot into something a little bit more human and patient facing. So yeah, I worked for a few pharma companies in my tenure, but then while I was working on digital health, a coworker and I came up with a concept around how we could try to address the caregiver and patient support side for dementia patients. So we started working on this about a year ago. And just like with the proliferation and the fast paced advancements with AI, it's really fueled our purpose and even ability to create something to serve the community. So yeah, like it really comes back to having lived the experience and seeing someone go through the condition, and also, like, my mom was the primary caregiver for a long time. So just kind of seeing that firsthand, feeling things as a loved one goes through it gave me a lot of like drive and passion to work on something like this.
Yeah, which makes sense. And I think, having when you get to that age where you're caring for parents and their health issues, trying to provide support, or if you're a parent caring for children, the caregiver is almost forgotten in a lot of the different solutions that are out there, right? We think very much about treatments and therapies and matching patients with the right kind of support that they need to get through it. But the toll that something takes, especially neurodegenerative diseases, can take on the family is a lot to manage as well. I mean, caregivers of any sort, right? It's a lot to manage, but I think particularly a neurodegenerative, as you and your family have gone through, right?
Yeah, for sure. I mean, you not only have like the side of like physically having to take care of someone who's becoming more and more dependent, but it's really like the emotional toll of seeing someone that was otherwise high functioning and just like turn into a shell of their former self. So like the like no disease is obviously pleasant to watch anybody go through, but just like that transformative change from like who they were as a person, just devolving, if you will, to something that they just never were.
Right. And so inspired by your own family and kind of your collaboration with your colleague as well, as you set out to kind of build something, how did you define what you wanted to go after and kind of what is that shaped into today with Matali?
Yeah, so the main thing that we wanted to look at, and originally we looked at using AR, VR headsets where we could project a companion that a patient could just speak to, and they're infinitely patient. They can talk about anything and everything, and it kind of is what spurred us something like completely aspirational in terms of like a cool new tech feature and how do we solve a meaningful problem. But yeah, it evolved, and we found that the elderly patients, and even a lot of just everyday patients struggle with the headsets due to like the latency and lag. So we pivoted away from that and basically have a web or tablet based interface now where there is a either a 3D digital avatar or just a voice companion that the patient is able to speak to. So we started defining out what that product and just that experience looks like, and then we quickly understood that it's not just like you talked about, and like something that wasn't completely obvious to me while thinking about this is that the caregiver and the families are also folded into this. So there's really two different things that we've built. First is yeah that voice companion and avatar for the patient, takes them through very structured conversations, is doing cognitive assessment. Families are able to share stories and photos during the intake process. The patient's profile is built out to give deep history of who they who they are, who they were. and weaving all of that into conversation. And then the on this caregiver side, it's really a portal to see how your loved one is doing and progressing through their journey. It's to prepare for their doctor's visits. And then the primary component is just like a conversational and guided tool that also takes the caregiver through the journey. Because I know, like, from my own experience, like when this diagnosis was happening, there was a lot of things that I didn't even know, like, what to ask for. The unknown unknowns are a lot. So just understanding things, even like procedural, like coming up with living will, how to navigate Medicare, like there's information out there all over the internet now. With the LLMs, it's easier to find that information. But what we've created here is just a guided coach journey for the caregivers to know what to look out for, to be able to share and save memories, to really have better connection with their loved one too, as they're having these conversations with the.
Yeah, I mean, I think that's an excellent point that the one of the things that in my family we've gone through in the last couple of years is caring for loved ones when they're going through a medical crisis. And because I've worked in tech for over 30 years, and because I very smartly partnered with a wonderful woman who's a registered nurse as my partner in life, right? We've got kind of an advantage when we're dealing with these things because of her background in nursing and medicine. Because of my tech, we're kind of able to bring the two together, and so we found ourselves using a chat GPT thread and just feeding all the information, all the conversations, all the test results and those things. But the piece that's missing, of course, is ChatGPT. At the end of each response, it always suggests some next action, those kind of things. But different than what you've built, it didn't really understand the full context and kind of what we were in. I'd have to imagine that's kind of a value added benefit. First off, for people, anyone can use your product and kind of walk up to it and benefit from the work and the content and the curated nature of what you've put together. But it understands the larger context of the journey that they and their loved one are on, and what type of support and frankly which directions the road may go, right? And kind of where things, things that they might need to be observant about, or like preparing for doctor's visits. I'm sure that people already are appreciating kind of how you have so much context built in and kind of understanding of what they're going through as they use the tool.
Yeah, so I'll touch on a couple of things there. The longitudinal aspect of it is been really meaningful and well received. So as you're having your conversations as caregivers, as family members, it's kind of mapping out your journey of like what is important to you. You're able to, as a family, like also upload a lot of photos, memories, and just do that real time, to kind of document what is, like, what does that path look like, and then that gets fed into the conversation with the patient. And that's where, like, that the assessment and trying to understand the patient's progression, how they're interacting with the stories, how they're interacting with the photos, has been really meaningful, because like it's the memories that are going. So the more that these memories can be reinforced, and more constant engagement with the patient, there is some retention there and just a deeper connection throughout the family. And then on the doctor's preparation side, several things happen where, you're preparing for a doctor's visit. Often with these providers, you don't get a lot of time, and it's hard to be in the moment and know, like, these are the things that have been most important to me. And sometimes you don't even know it. It comes out as you're trying to understand information and learn information, and then you express concern of, like, oh, like, what is this aspect of our life now going to look like? Or what is this part of the disease? And I want to learn more about that. So all of these conversations are synthesized. There's a feature of like preparing for the doctor's visits, and it not only is taking some of the indicators that are drawn out from the conversation, um, but also just preparing like a list of questions for what you want to cover. So you go into the doctor's visit with like a structured, agenda, if you will, so that you don't forget, or don't lock up in the moment, because it's very natural, very human to like just be overwhelmed. I mean, like, going to the doctor is never a pleasant experience.
And it is that precious time with the clinicians, or that's how we're treated to think at least, right? Is that, the doctors don't have a lot of time. They're seeing many patients. They're very busy. We've put them up on such a high pedestal that when we do get those precious, 5 to 10 minutes perhaps when we bring our loved one to a visit, we want to make the most of it. And I think that is an important piece of kind of like the preparation and the list of questions or the things, the issues we want to discuss. And then it's kind of taking up all the feedback from that, like what did we get for answers, and bringing that back in, or kind of round tripping that back to the tool, right? To then like, okay, here's what they said. What do we do with this next? Or how does that change things for us? Because most people aren't equipped to be a case manager for their loved one, especially dealing with something like a neurodegenerative disease, right? So I have to imagine that again, the feedback on the support side for the caregivers, they're really benefiting just as much as kind of the patients and kind of the work that you're doing with them.
Yeah, just the information recall, information retention in that highly emotional environment is also, yeah, challenging to remember. Like, okay, what is next? So like, what are the things that we should be doing? So as you like feed that into the platform, it can shape. It's shaping the conversations that are happening during the visit. There are data, there are talking points that can help the clinician better understand what is going on with a patient. There's this concept of show timing where a patient may present in a more heightened and coherent state than maybe they otherwise are day to day. So there's elements of providing the clinician with a clear picture of exactly what's going on a wider spectrum. And then also, yeah, that helps the clinician better diagnose, understand, provide recommendations, feedback, resources to the family to be able to care for themselves and the loved one.
Yeah. So let's talk a little bit more about the patient experience. You've talked about the family's ability to populate the tool with content, whether that's images or stories or things, memories. What does it look like? What's a typical kind of maybe, starting in the journey, and then obviously, as the disease progresses, I'm sure it changes in kind of the patient experience. But what's the interaction look like, and kind of how do they actually interact with the tool? Maybe we'll start there.
Yeah, sure. So the primary modality is either a tablet or laptop, or even being able to project that into onto a TV. The TV has been a very familiar form factor. So that's one of the things is like trying to maintain as much familiarity, not trying to introduce something new like a VR headset or something like that has been very well received. So there's a couple different paths where the patient themselves can initiate a conversation, and it's supposed to be as low friction, low touch point as possible. So I mean, you're logged in, you can start a conversation just in terms of free form, or if there's like some things you want to talk about. There's templates around like cooking or travel or hobbies or something like that. And the progression throughout the conversation will go through several different topics in those realms. But then also, if there's a situation where, or a family member has like uploaded a photo of like, they don't live nearby, they don't have that frequent conversation or contact. Just like, hey, I'm gonna upload a picture of like Tommy was playing baseball. It'll weave that into the conversation. It'll show the photo, and it will talk about it. It'll like measure what kind of engagement there is, and adapt. And one of the things that we really focused on is the prompt augmentation throughout the conversation. Not to get too technical into the weeds, there's a lot of parallelization of the analysis. So the voice agent obviously has to be super responsive. So we're not overloading that too much. So you're getting sub 1 second, like very natural conversation. But there's a lot of stuff going on the side too, really gauging acutely how that specific conversation is going. Are they engaging with this topic? Are they going to a different topic, and adapting to that? And then as the patient progresses through the journey, like it becomes different. We may early on want to probe and um, try to draw out memories, and uh, have the patient try to open up um, on a certain topic. But as they progress, that can cause a lot of frustration. You don't want to keep asking questions about like, "Hey, do you remember this? I'm showing you a picture." Like that back off is highly tuned to be sensitive to any resistance or any like shying away from or making the patient uncomfortable. The and again with the longitudinal nature of this, we're able to capture data very frequently and capture the coherence, the cognition, the presence of a patient, and try to adapt with them as they go through through the condition.
Yeah, there's obviously a lot of sensitivity about any kind of AI companions at this point, and there have been some very public cases and tragedies really that have been reported in the news, and there are lawsuits and those kind of things. So I have to imagine that safety is a top concern, and how you work with patients and kind of how you capture. And you were talking about some of the technical nature. Do you want to talk about kind of just overall guardrails and kind of how you've put that in place so it doesn't create risk, but really works to protect the patient, and kind of how you're supporting them and the family?
Yeah, I mean these concerns, and I mean the news stories out there. I mean they're real, they're scary, and especially when you combine that with like a very vulnerable population, it is of top concern. So like as engineered all of this, safety wasn't kind of something that was like bolted on at the end. It's like through every layer and every part of the process, safety and figuring out how do we build that in. There are again, to not be too there's like 5 layers that are distinct and built out in the safety. I mean, even from like the beginning, like just the chat agent has a lot of prompt engineering and coaching of like these are never events. These are things that we don't want to talk about. If this happens, this is how you alert a caretaker, and there's just some like core bits there. There's also the frontier models have capability to like add additional guardrails and just like never talk about topics that are just like hard blocks. But these can be defeated, and this is where a lot of the news stuff comes out. Where if someone's like continuing to badger, and you can get very creative. Um, how to bypass some guardrails. And it's not to say that the patient is going to be malicious in this, but by nature, if they're worried about something, they may try to ask things in certain ways that are just that could defeat a guardrail. So here we have several assessments happening on the content of the conversation. We're looking at things like elopement risk or abuse, agitation, low orientation, suicidal ideation, like all of these things that if we're starting to pick up on, we're able to first just like cut the conversation. Like if there's any indication that we're going down a bad path that could lead to a bad outcome, we just kill the conversation. And there's some graceful mechanisms to restart it, but all of the prior context that the LM had been engaging with is just wiped out. But yeah, we're looking at on every turn, every part of the conversation, what is the like we'll say suicidal ideation as an example. Is there a hint of it? And then if there are hints of it, the model adapts to really analyze like was this just a one-off or is this really going somewhere, and there are mechanisms with how you deal with that in the conversation, not trying to dismiss, not trying to shut down or ignore any of it, but like trying to constructively reframe, reorient what that conversation looks like. So that, and maybe like one other feature I'll mention is like as you know as you have a conversation with another human, not every topic, not everything is weighted the same in terms of emotional valence, importance of just what the topic is. But to, a quantized model, like it may not necessarily be like that. So we've developed another layer which like measures emotional valence of certain topic, frequency that they're talked about, and then the emotional reactions to it. So something like even like talking about a dog could be otherwise, benign. Like there's nothing inherently bad about it. But we've measured that a patient may have an emotional reaction because of a traumatic experience with that. So it becomes something that we have put off limits now. Steer towards a conversation or a topic like that. So Yeah, I mean, this could be maybe a topic in and of itself, but like the safety and just being able to control the conversation, having kill switches, having safeguards, redirection, is something that we've thought very, very deeply about. We've built a very extensive simulation protocol where we can design a simulated patient to continue to hammer these things too. And that helps us train our model to be able to handle situations. So yeah, safety has been a huge concern. We've heard from patients, investors, family members, friends, everybody. Like, how do you address this?
Sure. Yeah. And the way that the tool works is that when the patients have their interactions with the tool, you're then providing kind of notes or a summary back to the caregivers as well, right? So on good days and bad days, or times when you need escalation, they're getting those updates and the regular feedback about how these conversations or the cognitive assessments that you're doing, those kind of elements are going, right? So it's not like the family's locked out and you're the only one who has access to that information or the data, right?
Yeah, totally. So right now we're measuring 14 clinical indicators and 16 cognitive metrics. And those are the quantitative measurements. And then there's also like the qualitative, like trying to digest like what was the topic of the conversation. Here there's some sensitivity too. Say that the patient divulges something and or you know like share something that is private, like we are actively figuring out solutions for best managing privacy and drawing some boundaries there. But at the end of the conversation there is a summary that is distributed to the primary caregiver, and then any family members or relatives, friends that may have access to it. And that can be very fine grained control too. You may not want their brother and sister getting the same level of information as like the son and spouse. So yeah, there's some granularity there, but yeah, the data are definitely meant to be shared, and especially the clinical and cognitive information. We want that to be shared with clinicians. I mean, when we think about how dementia patients are assessed, it can be like once every 3 months and for 15, 20 minutes throughout like some of the standardized tests, like the ADAS cognitive or the I can't think of the other name of it. There's a few different, validated measurements, and we draw from that. We want to feed that into the clinicians. We haven't worked on like the EHR integration yet through the B2B model. That's still like, yeah, but eventually, like we want to get into Epic. We want to have real time information that goes to the clinicians to provide more informed care.
Yeah, I think it's probably a poor metaphor, but it's kind of like when you take your car to the mechanic, if it doesn't make that sound that brought you there, like in that
Mhm.
brief interaction that the patient may have with the doctor of kind of whatever, this gives you, because you're collecting much more data along the journey, or kind of like if you ever go and get your blood pressure taken when you go to the doctor's
Yeah, yeah.
office, but you've kind of you've rushed in, you're maybe late, you're thinking about some things, you're a little stressed or whatever, and then you get elevated, but it's kind of taking those readings apart from those other things to then bring that into the doctor's visit and show or kind of providing that I have to imagine that the clinicians will find that helpful as well as part of this whole process.
Yeah, of course. So it was the MoCA, the Montreal Cognitive Assessment, that we're also looking at. But yeah, I mean, you're getting much more granular slices of the life of the patient, and how they're doing. We're able to look at like time of day. We're able to talk like certain topics, like does mood shift, and as the pool of data grow, and even as the field of research is advancing, the abilities of this I think will just improve and get even more and more granular and more detailed for what we can provide to family and clinicians.
That's great. Part of this, I think most people would say, before I put this in front of the patient, my loved one, I need to trust it. So how do you build trust with the loved ones, with the family who's kind of engaging with this service before, they kind of expand and kind of give access to their loved one?
Yeah, great question. So this is also where the family and caregiver platform comes into play, where they're able to spend some time interacting with their side of the product, because the way that it's the patient facing product is you as a caretaker are probably not going to, you'll be able to demo it, of course, but really immersing yourself and understanding the quality and safety is going to come out with the caretakers and families working with it. And we've worked on making it just the user experience, the recommendations, being able to track like topics you've covered, providing resources, guidance, staying up to date on the latest literature, providing high quality information in a centralized place, and really just trying to help them understand like what the platform, what the product can do, and then realize that's the patient side of it is a natural extension of it, is just framed and structured slightly differently. But the underlying engine, the safety models, like down to like the technical stack, that runs on the same core engine. So there we see just like the emotional and experiential adoption and trust, and then also just, yeah, looking at using and showing like the validated nature of the product. So our science side of the team are looking at what clinical validation are we looking to explore. So I mean, the physicians, clinicians, like the gold standard is going to be a peer reviewed study, and there have been other, I don't say competitors. In reality, I wish there were more competitors because there's so much room in the space to look at. But similar products have achieved clinical validation with voice and cognitive engagement product. So our goal is to go through like that clinical validation phase to build that next level of trust and yeah, trust.
That's great. From a business model standpoint, I would assume this is kind of funded by the family, right? They come to the website, they sign up for an account, they pay a monthly fee and have access to the tool. Is that essentially it?
Yeah, that's right. And one of the things that we're very proud of is like the caregiver platform is free, and it will forever be free. I look at it as like the Costco hot dog or something. This is something where, providing that product to a family, like that coach journey, that is something that we feel very strongly that should be available. But then, obviously there are costs and elements to this. So it's really paying for additional features and paying for additional time and engagement with the voice and the avatar, and just um the more experiential and immersive nature of it comes with the monthly fee. And we've tried to structure that in a way where it's accessible through a wide range of financial capacity. So yeah, we care or sorry, the family and caretaker platform is available to everyone and anyone, and then it just additional features from there.
Yeah, it's a great way to get into it. So you focused on the dementia and kind of the neurodegenerative diseases at this point. Where do you go from here? Are there other diseases, use cases, or medical needs that you're considering building into the platform in the future?
Yeah, great question. So our CEO is a former, has had gone through two open heart surgeries, so we're looking at the cardiac space right now. There's similar to dementia, is like the amount of resources and coaching of clinician time available to patients is at a premium. So a similar guided journey, similar like, this is what you don't know, this is how you prepare for the cardiac space, is a natural extension. My daughter was diagnosed with type 1 diabetes in just this past year, and I mean, her mom is a molecular biologist. I have a technical and pharma background, and when we went through this, it was like holy, like it was a lot. It was, and we're at Boston Children's Hospital getting like top level care, and it's just so hard to keep track of. So we think that there's a use case there, and especially because of like like if if families don't learn how to take care of T1D for a 10-year-old, bad things can happen very quickly. But just like the education, the data management, the options and solutions for how to live your life in this new normal is important. And then yeah, I mean, in terms of like the applicability, I think any patient population that is going through this journey that's life changing, we feel can benefit from a lot of this.
Yeah, that's great. All right, one last question. For someone who's listening to this and might be going through this with a patient or a family member, what's the one thing you'd want them to know?
Yeah, so I think that guilt has been a big thing through all of this. I think people often think that they're not doing a good enough job. I think that they feel alone. So I think some of the biggest things are like, you're there, you're showing up, you're doing what you need to do. So you're not in it alone. There's resources, there's a lot of tools and just information that can help you. And there's a lot of support groups. There's things in Reddit, even in the Alzheimer's community. There's a lot of things that exist even beyond Mitali that are very helpful, meaningful, and I think people are just doing the best they can.
Yeah, yeah, very heartfelt, obviously, with your own family and the journey that you've all been on. It's inspiring to see that you're pouring yourself into this effort to try to help others and their family members do the best they can, and that's all we can. And just treating ourselves and
Yeah.
everyone around us with a little grace, right?
Yes,
Because the world is
exactly.
hard enough, and being able to kind of take that time and reflect on the good times and the memories that we've had. And I think you're doing a beautiful thing here. So, Jamil, thank you for spending time with us and telling your story.
Yeah, thank you so much for having me.
Great. For anybody who's listening, if you're dealing with this in your own life, hopefully this gives you a sense of what's starting to become possible in using technology in a very beneficial way. With that, we'll go ahead and sign off from the Health Tech Edge. Thanks for listening, and we'll see you next time.